We can hear each other, right, Bridget? Nobody else can hear us.
I think we are live right now, Dr. Meadows, so we have attendees
Oh,
on
hello,
as
everybody.
well.
Sorry.
So good evening, everyone, and thank you for joining our Men's Health webinar. We'll start with a few housekeeping items, and then I'll introduce tonight's speaker. First, your participation in tonight's webinar is completely anonymous to other attendees. No one can see your face or your name, and any comments or questions can only be seen by myself and our speaker. If you wish to ask a question, please type it in the chat box at the lower part of your screen. We will have a question and answer portion at the end of the presentation to address all of these questions. Our presentation tonight will last approximately 1 hour. Will be presented by Dr. Matthew Meadows of Uro Partners, based out of Chicago, Illinois. Dr. Meadows completed both his medical school training and residency in urology at Georgetown University School of Medicine in Washington, D.C. Dr. Meadows treats a wide variety of urologic conditions, including disorders of male sexual function, urinary incontinence, general urology, and minimally invasive urologic procedures. Dr. Meadows practices a patient-centered approach to urologic care, priding himself on the level of service and compassion patients receive from both him and his team throughout their treatment. Thank you all for joining us tonight. Without further ado, I'll turn it over to Dr. Meadows to get us started.
Thank you very much, Bridget. Thank you, everybody, for joining us. I apologize for my attire and not looking as good as I look in that picture. I did just run here from the operating room. As Bridget said, I am part of Uro Partners. I practice here in Chicago. I am a native of the Chicago area. As you can see from this slide, I did all my training in Washington, D.C. at Georgetown University, and then came back to Chicago to start my practice in 2004, and have been in practice here for 17 years on the north side of Chicago. I have, over time, begun to specialize more in men's health, specifically sexual health and incontinence. And that's what we'll be covering tonight. I look forward to a good discussion. Please put any of your questions in the chat and we'll try to get to them, as many of them as we can. Unfortunately, I'm not able to advance the slides, so I'll have Bridget do that for us. So part of what we're talking about here is erectile dysfunction. This is a very common condition. We'll start by just going over what is erectile dysfunction. And truth be told, I always tell patients that definition is a little different for every patient. The textbook would say it's the inability to achieve or maintain an erection firm enough to have sexual intercourse. I always discuss with my patients, are their erections satisfactory for the type of sexual intercourse they want to have? That's kind of the personalized approach. Are you happy with, the erections you have? Can they allow you to pursue the sex life you want? As you can see from the bottom part of this slide, erectile dysfunction is very common, and it gets much more common with age. We'll go through some slides in a bit about the medical conditions that go along with or can be seen in conjunction with erectile dysfunction, and you'll see how common these things are. You can see from the bottom of the slide there how many men experience erectile dysfunction. Again, getting people to sometimes answer these questions honestly. This is something people often don't like to talk about, so these numbers can be a little skewed. That's why I think these presentations are an excellent resource, and I love doing them because it allows people to listen and understand things who may not be comfortable necessarily even bringing them up in their doctor's office. Moving along, our next slide. We talked some about how common it is. Here, I think it's important to understand what is the process, what physiologically or what is going on in a man's body when a man gets an erection. Well, the penis is really a collection of a bunch of blood vessels. And when these blood vessels become engorged with blood or filled with blood, the penis becomes firm. And that's what leads to erection. At the same time as the blood rushes into the penis, no blood is able to leave the penis. So if you think of the penis as a vascular organ or really a collection of blood vessels, anything that affects these blood vessels, anything that causes these blood vessels to narrow or not be able to open as much as they can, will affect a man's ability to get an erection. Unfortunately, one thing that we cannot control is aging. As we age, every blood vessel in our body is narrowing and hardening, becoming less and less able to open and accept more blood. And this is part of why we see such an increase in erectile dysfunction as men age. In the lower right-hand corner of this slide, you can see on the left the flaccid penis, and you see the way they've drawn this where the blood vessels, all those little dots, are not full of dark red blood. On the right, in the erect penis, you see they've all filled with dark red blood. And what that requires is a healthy heart to pump the blood there and healthy blood vessels to open up and allow the blood into the penis. Moving to the next slide. These are the causes and comorbidities associated with erectile dysfunction. You can see in the kind of 12 o'clock to 4 o'clock portion of this graph, they've labeled that vascular diabetes, which many men have and is a vascular disease as well. Diabetes affects all the tiny blood vessels in a man's body. Medications you can see there. Again, to get all this blood to rush in, you have to have a rise in blood pressure. And if you're on medication that reduces your blood pressure, that can be hard to do. Some of the smaller slices of this pie, but I do want to address, because as urologists, we do treat a lot of prostate cancer. And pelvic surgery includes prostate cancer surgery. Additionally, heart disease or vascular disease, men who smoke, this causes the arteries to narrow and have less blood flow. And high cholesterol also causes the blood vessels to narrow, have less blood flow, including to the penis. Neurological causes you can see as a small slice of this pie as well. If there's been a neurological injury, whether that's a stroke, even back problems, anything like multiple sclerosis or Parkinson's disease, that affects the nerves that help these blood vessels open and let blood rush in. So a lot of medical conditions that become more common as men age and sometimes can be affected by lifestyle can cause erectile dysfunction. And oftentimes we'll see in a future slide, when men present with erectile dysfunction or come with a complaint of erectile dysfunction, we are obligated, or we need to look for these other diseases: diabetes, heart disease, vascular disease, high blood pressure, because these can be signs. Erectile dysfunction can be a sign of these other more significant diseases. So here's a little more in depth on diabetes, since diabetes is such a prevalent disease in the United States. I would guess that 15.3 million number is a little bit on the low side. There's many men who have undiagnosed diabetes. There's many men who have diabetes that is poorly treated. Unfortunately, because as I mentioned before, diabetes affects the blood vessels as well as the nerves in the body, it can really cause a real diminution in the erections and the strength of the erections. Keeping diabetes under better control can really lessen these effects. And so I'm always emphasizing to patients, it's vitally important to keep those sugars under tight control. Obviously, diabetes causes a lot of health issues, but this one can be very upsetting to men. Here at the top of this slide, you can see we're referring to nerve damage or neuropathy. Diabetes can damage many of the small nerves in the body. If any of the people listening have diabetes, maybe you have neuropathy, maybe you have family members or know people who do. That can affect numbness and tingling in the extremities, even pain in the extremities. It can certainly affect the nerves to the penis, which allow blood to rush in and get a good erection. You can see there at the bottom that all the pills that are out there, Viagra, Cialis, the generics now, sildenafil and tadalafil, they work by acting on the nerve endings in the penis. And if the nerves are not healthy in diabetes or other neurologic conditions, these oral medicines have less success. Additionally, the medicines taken by mouth require healthy blood vessels to deliver the medication to the penis. So again, if the blood vessels have been damaged due to diabetes or the nerves, the oral medications, Viagra, Cialis, will have less success. This is about men with diabetes. This is reiterating some of what I've said, but you know, as a men's health, someone who has an interest in men's health, a big part of health is keeping your diabetes under control or not getting diabetes. Unfortunately, as I said, advancing age and the hardening and narrowing of the blood vessels will cause some erectile dysfunction. How long a man has had diabetes for, meaning how many years have the nerves and vessels been exposed to these excess sugar levels, can have something to do with the degree of their erectile dysfunction. Further down, you see things we've already covered: heart vascular disease and heart disease. Now, heart disease, a heart attack, chest pain, these are things that obviously get men very worried. These are things that are life-threatening. I do sometimes explain the vascular disease and erectile dysfunction to men by saying the arteries to your heart are about 100 times as big as the arteries to your penis. If you've needed to have a stent or you've needed to have bypass surgery in your heart, that means those blood vessels, which are much larger than those to the penis, were significantly narrowed. So you can imagine the damage or the aging that has taken place in the blood vessels to the penis. We do know from studying men with heart disease and erectile dysfunction over time that a man who presents with erectile dysfunction has a greater risk in the future of developing heart disease. And you can see there that erectile dysfunction precedes the symptoms of heart disease in almost 70% of cases. So this gets back to what I was saying earlier, that when a man presents with erectile dysfunction, we want to take a good look at their overall cardiovascular health. This graphically shows what I was just saying, the size of the arteries that are supplying the different parts of your body. Femoral artery on the far right is the large artery that runs down your leg. If you feel a pulse in your groin, that's it. The carotid artery is the one in your neck. If you reach up here, that's the pulse you can feel there. I said 100 times bigger. I do that a little bit for effect. Point being, you can see with the penile artery on the left being much smaller than these other arteries, the penis is probably the first organ before the heart, before the carotid artery supplying the brain, before the femoral artery supplying the leg, that will show symptoms of vascular disease or damage to the blood vessels. How can a man reduce his risk of developing erectile dysfunction? Well, first of all, as I've said already, the heart is pumping the blood to the penis. So a healthy heart is the best thing. How do you maintain a healthy heart? Exercise, 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 keeping the weight down. Don't smoke. If you smoke, quit smoking. Reducing emotional stress, and your diet. Diet has more to do with keeping your weight down, controlling your diabetes, controlling your cholesterol. All these things promote overall good health. Overall good cardiovascular health is good for the penis and good for erections. Low testosterone. This is another big topic in men's health, and I don't know if any of the patients listening have been diagnosed with or are being treated for low testosterone. Testosterone is the male hormone. It is produced by the testicles. This is what allows men, this is what helps men have lower voices, more muscle, grow hair on their body. As men age, testosterone decreases. Testosterone in and of itself, normal testosterone does not guarantee good erections. However, having a low testosterone is not good for the erections at all. Those blood vessels that we looked at before in the pictures, they need testosterone to keep up their health. Conditions that can cause men to have low testosterone or be more predisposed to low testosterone, there's a lot of similarity to the list that you see with erectile dysfunction. Obesity, diabetes, high blood pressure, high cholesterol, prostate disease, and some of the treatments we have men undergo for prostate cancer do cause a decrease in testosterone. Additionally, asthma, chronic obstructive pulmonary disease, and it's not on here, but sleep apnea cause lowering of testosterone. Testosterone has a lot to do as well with a man's libido or interest in sex. It also has a lot to do with a man's overall energy and mood and kind of feeling of vitality. So testosterone is also something we need to screen for in any men who have erectile dysfunction. We can replace testosterone a number of ways. You can see here, there are gels, things that come like hand lotion or hand sanitizer, which we've all become familiar with over the last 10 months that men apply each day. Just recently, one of the first approved oral medications was released for testosterone replacement. And then the standard, the one we've had the longest, is injections. These can be given a number of different ways, anywhere from every week to every 3 to 6 months. Men feel much better when their testosterone is replaced. As long as they are monitored appropriately, it is very safe to get men back to a normal testosterone level. It can be very helpful for helping to restore not just erections, but overall sexual health, feelings of vitality, energy, libido. So low testosterone is one thing. Prostate cancer treatment. Again, I said prostate cancer is the big thing that we deal with as urologists. It's a thing that men need to be concerned about after a certain age, the same as they need to be concerned about erectile dysfunction. You can see in this anatomic drawing here where the prostate is located between the bladder and the urethral sphincter. The neurovascular bundles there, these are the nerves that travel to the penis and allow those blood vessels to open whenever a man wants to get an erection. Whenever the prostate has to be treated for surgery or even with radiation, these nerves and blood vessels are affected. They are very, very tiny, unlike the drawing you see here. And any disruption of them can cause some disruption of erectile function. So if there's any men out there who've had surgery for prostate cancer or had radiation for prostate cancer, they can attest to things are different afterwards. You can see here how many men have sexual dysfunction after a radical prostatectomy. I tell men things are not going to be the same. Ejaculation definitely goes away after surgery for prostate cancer, although men can still orgasm. But there is definitely a temporary and sometimes a permanent decrease in the strength of erections. You see in the lower left-hand corner here, even with nerve-sparing robotic surgery, which is our state-of-the-art prostate cancer surgery, there is a significant degree of erectile dysfunction after that treatment. And you can see in the lower right-hand corner of the slide here, radiation affects up to 50% of men. I do tell men before prostate cancer treatment, a lot of what you'll recover with the erections has to do with what you're bringing into the surgery or the radiation. If you already have diabetes, if a patient already has high blood pressure, is overweight, already has erectile dysfunction, their chance of having a worsening of their erectile dysfunction with prostate cancer treatment is much greater. Peyronie's disease is a much rarer condition, but not too rare. About 1 to 2% of men have Peyronie's disease, which you can see in the picture on the right here is a curvature of the erections. The most common curvature is what we see here called a dorsal curvature, or the penis points up towards the ceiling. The penis can curve to the side, it can curve down. Sometimes the penis can get so curved that it is difficult to penetrate or difficult to have intercourse. This can also cause erectile dysfunction and be seen in conjunction with erectile dysfunction. The cause of this is what we call idiopathic, meaning in most cases, we don't have a good idea what has caused this. It's a scar that forms in the penis, causing it to not fill with blood symmetrically, and then you get this curvature. You can see in the lower left-hand corner some of the treatment options. XIAFLEX is a medicine that we inject into these scars to loosen them up. Men can undergo surgery to excise these scars, and ultimately, men can have penile implants, which we'll talk about later. At that time, we remove the scar and put in an implant so that the erections are strong again. Here's some other treatment options. We've all been sitting at home a lot more. You got a lot of time to search for things on the computer. These are things that are out there. The American Urological Association, as you see in our disclaimer, calls these investigational. Extracorporeal shockwave therapy is something that has shown some effect in men who have mild degrees of erectile dysfunction. Meaning perhaps are using Viagra or Cialis, have not had erectile dysfunction for long. It tends to work better in younger patients. What it involves is delivering a low intensity shock wave to the penis over a series of treatments. This is thought to stimulate new blood vessel growth. All of these therapies we see here are interested in creating more blood vessels and more blood flow into the penis. Stem cell therapy, very experimental, as is platelet-rich plasma therapy. All of these therapies seek to increase blood vessel growth in the penis. The extracorporeal shockwave therapy is the only one I'm aware of that is widely available in the United States at this time. It is not covered by insurance generally, but has shown some promising results in men with mild degrees of erectile dysfunction. These are options you may be more familiar with. We'll go through these. I've spoken already. Everybody knows about Viagra was first to market, the little blue pill. Whenever I bring up Cialis, people say, is that the ad with the bathtub? All these medicines work by stimulating the nerves in the penis to open up the blood vessels so more blood flows in. How effective are they? You see here approximately 60 to 80% of cases. Again, the time that a man has had erectile dysfunction, the severity of the comorbidities or other factors leading to erectile dysfunction, diabetes, high blood pressure, smoking, high cholesterol, those will influence how effective Viagra, Cialis, or any of these medications are. There are about 5 or 6 of them out there. I keep referring to Viagra and Cialis, not because I think they're better, just because those are the ones people know the most. There can be some side effects that can cause men to not want to use these. You see here headache, facial flushing, upset stomach. These definitely don't put people in the mood to have sex. The medicines, in my opinion, are very safe. As long as a man does not have unstable angina, meaning regularly get chest pain, I think these can be safely taken. We have talked before that men with diabetes have less success with these medications. And again, that has to do with the nerves and the blood vessels where the medications act being more diseased in men who have diabetes. Other treatments that you see a little rarer at this point, intracavernosal injection therapy. Basically, these work the same way as the oral medications. They open up the blood vessels to the penis. The difference is the medicine is injected directly into the penis. I don't know if there's patients out there who are using these or have used these. Sometimes when I bring this up to patients, they say, really? The picture does look a lot like it looks here on the right-hand side of the slide. A man gives himself the injection of the medicine and the blood vessels open up and can get an erection. It is effective. This was around long before the oral medications. It can be a little more effective in men who have diabetes than the oral medications. What's the downside? There can be pain at the injection site. You can form a scar at the injection site, like Peyronie's disease, where we saw this is a cause of forming those scars, is doing these injections over and over again. There is a risk of a prolonged injection, or what we call priapism. As great as some people think that sounds, it's very painful and it is a big emergency. People do not like the lack of spontaneity here either, having to step out of the bedroom to go give themselves an injection. And people do fear needles. That being said, there are some patients who are very happy with this. But for the reasons I listed, a lot of people do stop using this after a period of time. Vacuum erection devices, believe it or not, are a low-tech but very effective therapy. How this works is basically a plastic cylinder is put over the penis. With a pump, a negative pressure is created, which draws blood into the penis. And then usually men do have to have a rubber ring or band at the base of the penis to keep the blood from rushing out of the penis. So the downsides you probably can figure out. This is somewhat unnatural to have to do this prior to sex, to have sex with this ring on the penis, which can interfere with ejaculation. There can be some bruising and discomfort. You can use this in conjunction with Viagra or any of the injections. Sometimes this is used after we do prostate surgery to stimulate blood flow and healing to the penis. Again, this is an option, but for a variety of reasons, many men discontinue. This is pretty rarely seen this day, a urethral suppository. The brand name of this was Meadows, which you see on the right-hand side of the slide. Again, works the same way. It stimulates the blood vessels in the penis to open up. This has to be put into the end of the urethra or the tip of the urethra, and the medicine is delivered that way. There can be a little bit of pain with the urethra. Sometimes this gets sufficient erections. It doesn't always. A lot of men are just not comfortable putting something in the end of the penis. And truth be told, with the oral medications coming out, this therapy is really not very popular any longer. And then there's the penile implant, which is kind of, the last step or the ultimate, the gold standard, depending how you look at it. This is usually for men who have failed the other therapies. This does involve a surgical procedure. These 2 cylinders, as you see, are put into the penis. This is all underneath the skin. It's nothing anybody else can see. There is a small pump in the scrotum that the man squeezes several times to fill the cylinders with fluid, and the penis becomes erect. The advantage is here, the erection is on demand. There's not taking a pill or an injection and hoping it works. you get the erection right away. You can see how effective it is and how many patients are satisfied with this. They have a lot more spontaneity. They have a lot more reliable erection. They can have multiple erections in a day or a night. Obviously, this does involve an operation with some attendant risks there, which we'll go over. But for patients who've made this decision, they're very happy with the ability to get erections when they want, have that confidence, that reliability. I think a lot of men who have these say they feel more kind of, I don't know if masculine is the right word, more vital and alive. It kind of restores their masculinity. They can get an erection whenever they want and can have a satisfactory sex life, both for them and their partner. There's a couple different implants out there. They all basically create a rigid erection on demand. On the left, you see what is the I wouldn't say most complex, but the one that allows for the most flaccid penis, the most natural kind of increase in girth and erection on demand. That's the 3-piece implant. There's a 2-piece implant, which is a little easier to work, as is the malleable. I have some patients who don't want to deal with having to pump things up. The malleable implant is basically just a hinged cylinder. It's a little simpler for some patients. We have some patients who don't have the coordination with their hands or the ability with their hands to pump something up, and these are good options for them. The 3-piece penile implant is really the most popular one now. It's been around for probably greater than 40 years at this point, 45 years they say at the bottom here. You get a good idea. I think we'll have a little more video later of how this works. You can see the pump down by the testicles there, which is squeezed anywhere from 3 to 7 times to inflate. The cylinders then fill with fluid. The penis becomes hard. At the end of sex, there is a deflation button, which allows the cylinders to empty of fluid and the penis becomes flaccid again. This most closely mimics a natural erection, both in its rigid state and the natural flaccid state of the penis. So patients really like that although there's something artificial in, the experience of sex does not feel artificial. It feels like they remember it when the erections were normal. You do see at the top here, the Boston Scientific prosthesis does have a built-in antibiotic treatment. That's a great safety advance for preventing infections, which is always a risk with this surgery. This is the movie I described earlier about how this works. Do we have sound with the movie, or do I need to narrate it? Here you see the man squeezing the pump and the cylinders are inflating. And there is the deflation pushing the other end. This is a little bit about the surgery and what a patient can expect, what I tell patients to expect. In most men, I perform this as an outpatient procedure, meaning they go home the same day. It's about a 2 to 2.5 hour procedure. I make a small incision above the pubic bone. I tell men they're going to be sore for about 2 to 3 days. They're going to want to use ice packs. You have to wait about 4 to 6 weeks before using the device while it heals in place. Shortly afterwards, we have men start pumping up the device so they become comfortable with it. That also maximizes the length and girth of the penis when it is erect. Most men take pain medicine for a few days, and then I generally say wear loose clothing and don't ride a bike or a horse or anything, but other than that, can be back to most of their activity within about a week or two. Most insurances cover this. anytime I do the surgery, and any surgeon I hope would check thoroughly to make sure that insurance is covered, but insurance coverage for this procedure is quite good. Very rarely do we have insurance decline to cover treatment for erectile dysfunction, especially the penile prosthesis. Here we have a couple patient experiences. You can see the man on the left had diabetes and high blood pressure, both risk factors for erectile dysfunction, and eventually got a 3-piece implant. The man on the right was treated for prostate cancer, and their testimonials, I don't know that we can hear them. Obviously, they were quite happy, as were their partners. Again, as I said earlier, these have been around a long time. The penile implants, they have been perfected over time, making the pumps easier. The antibiotic impregnation really decreased some of the risks of infection and complication. Usually are covered by insurance. Most of these are in use after 10 years, as you see, about 90% of them. I do tell patients these have about a 10 to 15-year lifespan. When these give out, we can always replace them, switch them out for another. That obviously is another operation, but we do that for men who are obviously quite happy and want to continue using it. Does not change ejaculation or orgasm, as I mentioned earlier. Those should feel and be the same. And it's really the spontaneity, I think, that patients like with the penile implants. The risks we always have to talk about. Infection is always a risk when we're putting something foreign in. We're very careful doing this surgery. There can be some pain while things are healing up. And the mechanical failure, which I discussed, these are all moving parts, and just like anything, they can wear out eventually. When you do a penile implant, you do caution patients. The blood vessels are being now occupied by these cylinders. Viagra, Cialis, the injections, those are no longer feasible with a penile implant. Not a problem, as you're able to get erection spontaneously and when you want, but that's something I always go over with patients. So to summarize, and again, we'll take questions at the end here, erectile dysfunction is a very common problem. It goes along with a lot of other health problems. It is a problem that has cures, though, and treatments, and very good treatments for patients. So obviously, if you're attending this, you're interested in learning more about the treatment and cure. There are many physicians, myself included, who really enjoy helping men with these issues. And so I would encourage you, either through this or a follow-up, to reach out to talk about it. We're going to talk a little bit now about urinary incontinence, or loss of control of urine, which can be multifactorial as well, but I think is also very much in the urologist domain. We've talked some about prostate cancer treatment. Many prostate cancer treatments and many treatments for other diseases can lead to incontinence. Again, fortunately, we do have ways to help men with this. It's not just something you have to live with age. So quickly, as a definition, what we're talking about here is stress urinary incontinence, which is the involuntary loss of urine when putting some kind of stress on the pelvic floor. Most commonly, this would be coughing, laughing, sneezing, lifting something heavy. It is fairly common. It happens to men and it happens to women for different reasons. But again, in men, often previous surgery can lead to this. Here is, again, an anatomic diagram that shows how your body controls urine. You see the bladder there at the top. The urethra flows right through the center of the prostate. The first portion of the urethra is really just a canal through the prostate. Right below the prostate there, you see the sphincter. That is the muscle that helps you control urine. If you remember back to the slide I showed about prostate surgery, the prostate has to be peeled off both the bladder and the sphincter here. And the nerves that control those muscles can be damaged during prostate surgery. And that's why incontinence can be a problem after prostate surgery. Incontinence can also be a problem after other pelvic surgeries, whether on the colon, which we don't see in this picture, but would be to the right of the prostate and the bladder in this picture. A lot of the surgeries we do to correct incontinence involve strengthening the sphincter or creating a new sphincter so that patients have voluntarily control of the urine again. So again, here's the numbers. As urologists, these are numbers we're always looking to improve on. They're not numbers that we are proud of. We want them to be better, but there have been a lot of improvements. About 50% of men, I actually think that's probably higher, report leakage immediately following surgery for prostate cancer. With the prostate removed, everything is different. Men need to learn how to recontrol their urine. Most men get pretty good continence or control of their urine back, but you can see there, according to these numbers, 9 to 16% of men have some incontinence 1 year after treatment. I did mention these other categories of treatment that can cause men to have incontinence: pelvic surgery, radiation. When a man is leaking urine, this leads to all kinds of problems. You don't feel comfortable going out socially. This can affect your mental health. You become more depressed. You focus on this cancer treatment. Even if the cancer's gone, your life has been altered. And so I definitely encourage men who are suffering with stress incontinence to please talk to a physician. There are things we can do to really improve the overall quality of life and get you back to doing whatever activities it is you want to enjoy. So there was the picture again that we went by quickly of the prostate surgery. Here are some more simple things that you can do prior to surgery and that we obviously encourage patients to do before we take them to surgery. There are behavioral modifications, reducing fluid intake, specifically things like coffee, tea, and sodas are bladder stimulants. There is physical therapy men can do to build up the sphincter and those other pelvic floor muscles, and that can be very effective. Over on the right, these are not strategies that I, as a doctor, am crazy about. This is really falls under the rubric of coping. You wear a pad, you wear a diaper, you know you're leaking, but it's a little less problematic, yet still a problem. That's not a great way to go through something. And over time, these solutions can be quite a nuisance and quite expensive. Paying for pads, paying for adult male diapers. We really discourage men from having catheters in long term, as these can lead to a lot of side effects. So men who have serious incontinence or bothered by it, I'm happy to be able to offer solutions to. One of these solutions is what we call a male sling. You may have heard or know females who've had slings put in for incontinence. What this is a operation that involves putting a piece of mesh underneath the urethra to strengthen it so that it has more ability to close when a man coughs, laughs, sneezes, puts pressure on the abdomen. You can see here the success rate is quite high. Most patients are continent immediately following the procedure. This is a good option for men who have what we call mild to moderate stress incontinence, meaning when putting the abdomen under stress, coughing, laughing, sneezing, again, swinging a golf club, there's a small amount of leakage. This is not always effective for men who are very wet, meaning dripping all the time. But those men who are appropriately selected for the sling get excellent continence, and as you can see, 92% of it are quite happy. This is a good anatomic diagram. You can see that mesh is kind of the white, looks like a window mesh or a window screen there, which we placed around the urethra to support it. This again is an operation, takes about an hour and a half, 2 hours. Men go home the same day and usually notice a significant improvement in their continence right away. A great solution for men who have more significant incontinence is the artificial urinary sphincter. This is also something we implant in the body. This is, as you see, the gold standard treatment. No matter what degree of incontinence a man has, usually we can get them dry with an artificial urinary sphincter. The difference between this and the sling, like the penile implant, this does have a button that requires the man to operate, which we'll see in a moment. It is totally undetectable to anybody else, and is very effective in getting men dry very quickly. Here is a good diagram of how this operation works. It may look somewhat similar to the penile prosthesis in that there's a pump in the scrotum. What's labeled as the cuff there is like a balloon that we wrap around the urethra and compresses the urethra, keeping the urine from leaking out. When the man wants to urinate, when his bladder is full, he presses the control pump several times, obviously while standing over the toilet. This deflates the cuff around the urethra and allows him to empty his bladder. The cuff then automatically re-inflates. So this cuff makes men continent because it closes the urethra. It does require doing something each time a man wants to urinate, but is very effective in helping men with severe incontinence. We'll have a little movie here. I'm not sure if I need to provide the narration, but I will do it just in case. So here we're seeing the same diagram. Up above in the upper right-hand corner, that is the reservoir where the fluid is stored. You see as the man has pressed it, the cuff is deflated and the urethra has opened. The cuff is now spontaneously re-inflating and compressing the urethra so that there's no urine leakage. This is again an outpatient procedure. It takes about 2 hours. Men go home the same day. You have to wait about 4 to 6 weeks before we turn on this sphincter, meaning it needs to heal in place before you can start squeezing, inflating, and deflating that balloon. But once we turn it on, men go from dripping all the time to completely dry, and it's really rewarding to see. It's really great for the patients. They're very happy, and we're very happy to help them this way. You can see here the patient feedback about, what they felt like after this, obviously understanding what they were getting into, being comfortable using the sphincter. But for those patients who are motivated, it's really a life changer and a great operation. Again, usually covered almost always by insurance. Always check that out beforehand. Here's a couple of men, both of whom underwent treatment for prostate cancer, giving their quick testimonial. Prostate cancer, post-prostate cancer treatment, by far the most common reason we put one of these sphincters in. So in summary, stress incontinence is a very common problem that men have. It's not something men just have to live with. It's not just a part of aging. There are good operations available. Both of them do involve implanting something, but it is totally concealed within the body, and really can cause a great improvement in continence, which is like returning to normalcy. We saw those negative things that happen when men are incontinent. They become socially isolated. They don't want to participate in activities that bring them joy and pleasure. And this can really get men back to doing whatever they want. Of course, we have to go into the side effects here. There's side effects and risks with everything we do. Infection is always one whenever we put in something that is foreign. There can be erosion of the urethral cuff, this balloon putting pressure on the urethra. We have to find the good balance between making men continent and making sure there's still adequate blood supply there. And obviously device failure. These devices are mechanical. They can give out after time. One with the sling and with the sphincter, we do have to think of as urinary retention. Again, we're trying to find that perfect balance between keeping a man from leaking, but making sure he can empty his bladder. Those are pretty rare things, but obviously things I would counsel any patient about before we went into surgery. So again, just to summarize incontinence, it's not something just like erectile dysfunction. It's not something that just has to be part of aging or something men just have to live with. There are good solutions. I would encourage you to talk to either myself or any physician about this. Urologists specialize in this. It's an important part of men's health to have a good sexual function and urinary function. And I'm not sure how we're going to do the questions here, but I'm happy to try and answer what questions we have.
so much, Dr. Meadows. That was a great presentation. We do have a couple questions that we received throughout the presentation. I will go ahead here and start reading.